Over the 6 previous NIAA stewardship symposia, the symposium agendas have addressed many timely issues, from potential links between antimicrobial resistant bacteria that affect food animals and antimicrobial resistant bacteria that affect people, to the development of antimicrobial stewardship programs in human hospitals and in animal industries, to the presence of antimicrobial resistance in bacteria in the effluent from sewage treatment plants, to the oversight of antibiotic use in animal feeds via the Veterinary Feed Directive, to the difficulty in comparing the use of antimicrobials in food animals to the use of antimicrobials in people, as well as many other important antibiotic issues. At the very least, there is now broad recognition, I think, across the industry that there is a need to use these valuable medical resources for treating disease in a judicious manner with a medical professional specifically overseeing their use. Our first panel will share their perspectives on the current status of efforts to ensure that antibiotics have their appropriate place in disease management. Our first panelist is Shannon Wharton, who oversees the Education and Research Center for High Plains Feedyard in Montezuma, Kansas. A more complete biography is located in your symposium agenda, but briefly, she holds a Bachelor of Science from Penn State and advanced degrees from both the University of Kentucky and Friends University. She is responsible for the daily management and collection of biometric and environmental data, as well as customer service and resource management. She and her husband, importantly, own a cattle operation in Syracuse, Kansas. Ms. Wharton. A little louder. Should use that mic right there. Yes, please. Mm-hmm. Yeah, let me move that over for you.
Thank you, Dr. Saltman. Oops. Let's start it. So just a little bit of background about me. I grew up in Pennsylvania and decided when my husband and I got married, I went to the University of Kentucky, that we wanted to live where the cattle outnumbered the people. And we found that in southwest Kansas. I did not grow up in agriculture. And so when I started in the beef industry, I looked at there's all these segments in the beef industry. We go from the cow-calf segment to the stocker segment to the feed-yard finisher. They don't always communicate. Cattle change hands, change ownerships through that. And with that, we have a lot of shrink in the industry, whether it be tissue, whether it be vaccination. We're over-vaccinating sometimes because we don't know the history of the animals. And that all adds up. And obviously, there's economic shrink. Everybody's got to take their little piece, their commissions out of it. So now my husband and I, like he said, own a cow-calf operation, and we also have a 1,000-head stocker backgrounder operation. About a year and a half ago, I had the opportunity to join High Plains Feedyard and work in their education and research facility. High Plains Feedyard is a 50,000-head commercial feedyard. What makes it unique is we have 85% of our cattle are customer-owned, so we get to work with a lot of producers. A lot of big feedyards nowadays are corporate-owned, and the corporations own the cattle. So we still touch the producers a lot, and we feed some of the best genetics, and we feed some of the worst genetics, and we have to know how to manage them. So I always talk with producers, and first of all, I say a calf has its performance potential. It's up to us to decide what we do with that potential. We have to express it, and we can either maintain that health, improve upon it, or harm it. So first we look at genetics. We make the investment in good quality genetics. We have that predictability that comes with it, and we know some of the higher genetics are going to grade. They're going to be quality animals as long as we don't mess them up. Then we talk about nutrition. Nutrition has such a huge impact on the health of the animals, starting from prior to conception all the way through. If that cow's body condition is not in good shape when that animal is conceived, it affects that calf for the rest of its life. So we need to manage nutrition from prior to conception on. When you have an unbalanced digestive system, your feed intake declines, your nutrient utilization declines, and that increases your health problems. A lot of our respiratory problems are secondary to nutrition. And then also from the economic standpoint, economics drives our producers. We will start seeing discounts in carcass value. And temperament, we work a lot on temperament. Handling stress also increases health problems. So we work a lot on low stress handling techniques, minimizing use of cattle prods, working quietly, not overcrowding. All of that impacts the health of the animal and the ultimate performance. And finally, what we're focused on today is the health of that animal, the weaning protocols, the history, using the recommended vaccines, using proper vaccination schedule. Even when we do everything right, we will still have some animals that will get sick. So we work very closely with our veterinarians and follow their treatment protocols. They're the ones that are the experts as far as the drug interactions and proper diagnosis, so we rely on them heavily to follow those protocols. Everybody in the Feedyard is BQA certified, which is the Beef Quality Assurance Program, as well as some of our producers. So our genetics plus our environment equals our end product. Here's some pictures of the new research and education facility that High Plains invested in. We have some of the state-of-the-art facilities. We are data-driven. Everything we do, we collect lots of data. We have a DVM PhD on staff that helps oversee some of our research. We bring together everybody along the supply chain. For our grand opening, we had all the way from seed stock producers all the way up through Cargill, McDonald's, World Wildlife Fund, all sitting in one room. We have one goal, and that is to produce a high-quality product for the consumer and make it economically viable for our producers. So it's really unique, just like it is here in this room, to have all the diverse people together, to have that whole supply chain come together. We don't do it by ourselves. We have what we call our High Plains family. We work with cow-calf veterinarians, seed stock producers. We work with the number 2 seed stock producer and the number 6 seed stock producer in the United States. We work with one of the largest veterinary research consulting services for Feedyards. We work with banks, marketing, accounting firms. So when we have problems, when our customers have problems, we can bring the group in together and let's all figure this out together and let's make it better. Some of our research areas, we're doing some residual feed intake research. We do genetics research, nutrition. We do some antimicrobial research. We're looking at vaccination schedules, timing of vaccination, the impact on the cattle. Something new that we're starting is we're trying to collect data on these animals prior to coming to the feed yard. We're looking at our producers and saying, okay, what's your mineral program on your cows? What's your creep feeding program on your calves? What's your weaning program? So it goes beyond the vaccination. What is the whole management of that animal and how that's impacting performance? And just a real quick example. This is some GARDINER Angus genetics that closed out at the feed yard in June. GARDINER Angus is, like I said, the number 2 seed stock producer in the United States. This is the upper echelon of cattle. These cattle perform well. They grade well. Down at the bottom is just in the red box is the summary. You can see the cattle graded 96% choice or higher. They were 10% prime. They brought $7.69 over the market. Maybe that doesn't mean a lot to some of you, but to a cattle producer, that $7.69 a hundredweight is huge. That's a huge economic benefit to us. But even within these cattle that perform so well, you can see our death loss in that column, the variation in it. We had one group that had 3% deads, a couple groups that had 0%. So within these cattle that have these good genetics, what are our management practices that we can get everybody at 0% death loss? That's our goal, a lot of preventative maintenance. And what can we do to make it better? Thank you.
Thank you. Our next panelist is Joe Swedberg. Joe is former Vice President of Legislative Affairs for Hormel Foods. He is currently the chairman of the board for the Farm Foundation, and he also serves as chair of the Farm Foundation's Antimicrobial Education Project. He grew up on a cattle and grain farm and received his Bachelor of Arts degree from the University of Northern Iowa. Mr. Swedberg.
Thank you very much. So today I want to talk a little bit about kind of where we've been and how that relates to some of the collaborative efforts. And then tomorrow I'm going to talk about where we're at and going with particularly around a partnership with the Farm Foundation and the Pew Charitable Trust. But when listening to Dr. Linfield earlier, I think she'll remember back, it was probably 6, 7, 8 years ago maybe. Remember when Will Houston pulled us together in Minneapolis. Dr. Tim Johnson had headed up the health side for the medical, for the human health side. And there was this group in the room of ag people and human health people. And we started out sitting on opposite sides of the room, and I remember they made us all get together, like Ruth said, for the Minnesota One Health initiative. I think I sat across from Ruth. I think she was a little bit scared of who was on the other side. But I remember that vividly in the sense that when the meeting started to when it ended, a couple of days, it was amazing the conversations and the shared values that were in that room that hadn't been expressed before, because I think so many times we had ended up squaring off and never talked to each other. So we actually got to see what people looked like on the other side, and they were actually had some interesting things to share. So but I commend Minnesota. I spent 30 years of my career there, and the progressiveness and the sense of what they're doing there is really amazing. So I just want to talk about kind of where we've been. The Farm Foundation, really it's an organization that does not lobby. We're really a convener, so we bring people together, and that's what we're all about. And I think last year we had some folks here talking about that, so I won't go any further with that. But this is a history of antibiotics in the livestock production. I hate eye charts, and this is one. I'm sure it'll be in the notes you can get. But I think it's an interesting history from 1950 when the FDA first used and came out with antibiotics as a growth promotant for food source animals, all the way up to 2015 and now 2017 with the guidance 209, 213 and the VFD, which is really what I'm going to talk about a little bit today. So many of you know these came into effect. They came about several years prior to the implementation in 2017. And what we did from the Farm Foundation's perspective was look at what can this organization do as non-lobbying to help ensure the implementation of this voluntary program. And because the pharmaceutical groups came together with FDA, and Dr. Flynn sitting next to me will remember that, and came up with this, and they all agreed to implement these. And so how are you going to do it? So we had a meeting, I think it was in January of 2015, Bill. We sat across from Mike Taylor, and Bill was in the room along with many others, and discussed from the Farm Foundation and some private companies, I was still with Hormel at that point, can we help implement this? And there was some gaps out there, and our thought was, can we help implement and go out and educate the producers, the veterinarians, the feed producers, and other organizations that are going to be impacted by this. So we've still got 2 years for implementation. I remember Dr. Flynn talked about we only had enough funds in our organization to do 5 outreach sessions, and they covered different parts of the United States, but they couldn't cover anything in the Southeast. And so we saw some gaps. So long story short, we ended up putting together 12 different regional discussion groups across the country with the help of FDA and USDA. Larry Granger's in here, and he was helpful with this process. And we did sessions, and we tried to get local veterinarians within that region, producers within that region, feed producers from that region, and be able to have them educate and talk about what do these mean. I also have to say that during those times, Dr. Flynn, Mike Murphy, and Craig Lewis from FDA were at all of the meetings, one or the other. Also at USDA, Larry Granger was at most of the meetings, along with Chuck Fossler and Kathy Bjork. And I think that was probably one of the most important parts of this whole process, was having these people in leadership roles from both USDA and FDA at these meetings to meet with producers face-to-face, to meet with veterinarians face-to-face, to meet with feed producers face-to-face, to have these conversations. And if we got nothing else out of these meetings, I think that was one of the most powerful pieces to this, was an example of when you implement something that's so concerning to a lot of people, complex, is a big change, to actually go out there face-to-face to have these meetings. And I think it meant so much to those people to have leadership within that. There were 36 major questions that came out of these 12 working groups. They wrote all of these questions down, and Dr. Flynn made sure every one of those questions was answered, and a few months later, and it was all published with as a part of that. So I think that was a big part of this. So each workshop, we did a pre and post survey to find out how much people knew before they came in and after they came in. So I thought that was important. We had significant discussion times for each participant within those workshops. What we found out was there was a need for more education and outreach. So despite the work that had been done, there's still a lack of awareness out there. And so we looked at cooperative extension. Feed suppliers have a critical role in providing additional education. So we did get funding after that to go out and actually do some additional work and educate those folks. We made flyers for feed operations. We did some radio broadcasts. We actually did some TV programming on RFD TV to help educate. The next thing was continue a dialogue between the industry and the state and federal regulators, which I thought was important. And that's where I talked about earlier, having people like Larry out there and Bill out there face-to-face with these folks and the interaction. You just can't duplicate that. And the last thing we found out was access to veterinarian services and supply for food animal veterinarians. So are there options to provide veterinarian service to smaller producers? In some of these instances, there wasn't really that veterinarian producer relationship just because of the sheer distance, hundreds of miles apart. So how do you bridge that gap? Is there new ways to do that? I know there's been some bipartisan legislation introduced, the medical loan repayment program for particularly large animal vets. And we found that there was even some big gaps in the metropolitan areas was one of the biggest concerns because of the hobby farms that would be around that metropolitan area. People did not know that their responsibility with the VFD and 209 and 213 were involved with that. So I thought that was interesting findings. We had a major conference then in January 2016 to talk about all these findings and where do we go from here. These are some of the collaborators with that. It was a pretty quick project. We had a 6-month less than 6 month turnaround to get funding to go out and do these major 12 sessions around the country, and these are many of our partners that were focused in that. So where are we today? And I'm just going to leave it at kind of where we're at today, and then tomorrow I'm going to get in on the panel that I'm on, some specifics by what's going on within that. So the Farm Foundation has partnered with a few charitable trusts and livestock groups. And if you would have said this to me 2 years ago, that we're going to partner with Pew and the livestock groups, you probably all would have looked at me and said, there's no way that's going to happen. And I can tell you it has happened. It has been I think, a very interesting, remarkable partnership. Some of you in the room here today are a part of that group. I'll talk more about it tomorrow. Steve Solomon, who's sitting in front here, herds the cats for that group. He chairs that committee, and it's been a very interesting, but I think productive process. And so I'll share more about where that's going and where it's at tomorrow. Thank you.
Thank you. Our third panelist is known to many of you, and he has presented at several of the previous antibiotic symposia. Dr. Bill Flynn is Deputy Director for Science Policy at the U.S. Food and Drug Administration's Center for Veterinary Medicine. He is responsible for advising the Center Director and CVM's senior management team on significant cross-cutting scientific and policy-related issues that confront the Center. He is a veterinarian who was in private practice for several years in Maryland before he joined FDA 24 years ago. Dr. Flynn.
Thank you, Roger. Thanks for the opportunity to be here again. When asked to provide an update on progress, I thought I'd look back on sort of last year, the 2016 symposium, and some of the topics that were discussed there, and I look back at my some slides that I presented, and one of the focus that we talked about last year was sort of where in fact are we going? In other words, what's the goals and what are the objectives? There was a lot of focus has been on what actions do we take? How do we implement those actions? But perhaps not spend as much time focusing on sort of what the goal is in terms of where. And so, particularly when you ask the question, have we made progress? I guess the question is towards what goal and what's where are we headed? And I think that was something that was a topic of discussion last year. And so I was sort of reflecting on, have we made progress on that point too? And just in terms of clarity around the goals and objectives. And I think it was a good segue from Joe's last slide, which is I think the good news is that I think there's been a lot of progress just on that very point. I know there's been a lot of efforts over the past year in a variety of venues and different groups, including the work that Farm Foundation and Pew have been doing, but also AVMA and others have been focused on this question around building consensus around what in fact does stewardship mean, if in fact what we're really focused on here is really not an exercise in simply antibiotic reduction, but with a goal of what can we do to curb resistance or slow resistance emergence through fostering antibiotic stewardship. So, and I found this slide that I had put up there last year, which I think was trying to just send the message, because I think there's a lot of concern about what that end game is, and I think we're not. Obviously, FDA has a role to play in this, although we're just one component, and there's many others that play an important role in helping to address this issue. And certainly, our primary focus is not necessarily simply on reducing antibiotic use, but in fact, sort of driving towards slowing resistance through good antibiotic use practices. Doesn't mean that there aren't good practices out there now, and that there's a lot of folks that are doing good things and are using drugs appropriately and have various quality assurance programs in place. I think the idea is, try to focus energy on identifying where there's areas that improvement can be made, so that the things we're doing sort of on the left-hand side are driving towards slowing resistance emergence on the right end of that arrow. So from FDA's perspective, we've kind of been focusing on three kind of basic areas. One, actions or activities related to the products we regulate, and that's probably the area we have most direct responsibility, are the drugs themselves, in terms of how they're labeled, how they're approved, the conditions of use for which they're approved, and certainly that's a key role that we play. We're certainly doing what we can to support efforts to facilitate good use practices at the farm level, but again, there's a lot of other folks that need to contribute to that effort. And the third area is really what can we do in terms of monitoring progress, enhancing the data that we're collecting and capturing, so that we can make sure that the things we're doing are making a difference, and we can sort of track the progress that we're making. So those are three really important areas that we continue to focus on. So the first area, and Joe's referenced this already, and I think this is in that sort of first bucket of aligning products, and I think this was what I'm going to provide a few comments on, which clearly over the past year, this is, we're now 10 months into implementing these changes, but this was a strategy that was, going back to initiating development actually before 2013, but we initiated a three-year plan in 2013. So there's really three pieces to this. There was an initial guidance document that we put out in 2012, which would say, well, here's basically the goal, and the goal is we want to make changes to two important changes to medically important antibiotics used in feed and water, to really make sure that the uses of those products are focused on those uses that are really necessary for addressing animal health, and then make sure that any remaining therapeutic uses of those products are under the oversight of veterinarians. We then followed up with another guidance, which was really the implementation plan. That's what 213 is about, And it's laid out the framework and the timeline to get those changes done in a 3-year, over a 3-year period. The third really important piece is the Veterinary Feed Directive regulation, which as we began discussing this sort of overall strategy with folks, I think this is one issue that surfaced really quickly. I mean, you go back to 2010 or so, and we started talking about this issue, when clearly one of the key changes here was to shift products, feed products, the feed or water products that are medically important from over-the-counter status to veterinary oversight. And so for feed products, that means changing them from over-the-counter to VFD. We heard very early on that, you know, that is going to be a rate limiter because the existing framework for veterinary feed directives was felt to be too onerous, and there was a fairly limited number of products under that framework at the time. And the concern was we shift a large number of products under VFD that'll just collapse under its own weight. And it was identified earlier on that that's an obstacle to successful implementation. We need to deal with that. And I think that's one of the reasons, too, for that 3-year plan was enable time to get those changes done to sort of grease the skids, so to speak, for those changes going into effect. So it was an approach really that was intended to be risk-based. It was meant to focus on medically important, meaning those, not everything that's an antibiotic, but those drugs that have human medical importance because of the link of resistance to public health. We focused on feed and water products because those are the products where by design there's a greater exposure because they're formulated and designed for the purpose of administering to larger groups of animals. And it was really those two focuses that was really the focus of this strategy. So, and then the approach taken, again, was one that we engaged folks very early in this process and identified who all the key stakeholders were, which there were many, and including the pharmaceutical industry, the animal feed industry, producers, veterinarians, to really start to develop a plan and start to identify all the issues that needed to be addressed as we move forward down this path towards putting the changes into effect at the end of that 3-year process. And in effect was voluntary in the sense that we were asking the pharmaceutical industry to agree to voluntarily come into FDA and change the labels of their products to align with the recommendations of the guidance. That's the voluntary part. Once those changes are made, it really isn't voluntary from then on out because once those products have been relabeled, growth promotion use is removed, and brought under prescription or VFD status, those conditions really are required for the producers and veterinarians. And in some cases that notion seemed to get lost on some folks, but certainly it's an important aspect of it. So at the end of the day, basically, we set a target for January 1, 2017. Good news is we got very good support and collaboration from all the affected drug companies. I think there were roughly about 25 or so companies that had products affected by this. So at the start, we identified about 292 approved drug applications that were affected, so meaning they were approved for use in feed and water. They were medically important antibiotics. Some of which had growth promotion uses, but by no means all of them did. But they were all those products were over the counter. So many of the products, actually, those approved applications were a large percentage of them weren't necessarily marketed products. So companies had to make a decision about whether or not they were going to update those products, even though they may not be marketing them at the time. So as a consequence, in some cases, companies decided simply to withdraw applications rather than update them if they had, no intent to return them to the marketplace. So basically 84 applications were withdrawn as part of that, and then of the remaining 208, there were 93 water products that were converted from over-the-counter to prescription, and about 115 that were converted from over-the-counter status to veterinary feed directive. And then there were 31 applications that had growth promotion uses that were withdrawn from their application. So that's sort of the overall accounting of, and basically we hit that target, obviously a lot of heavy lifting with a lot of folks to get this done, and, we certainly appreciated all the the support we got from the pharmaceutical companies in getting these changes done by the targeted date. So certainly this is a significant step forward in terms of really shifting, making some pretty significant changes to how antibiotics have been used. As Joe mentioned, there was a lot that went into this, and I think the thing that's really positive to see about this is that the amount of engagement and collaboration that can occur to accomplish a goal. And there was certainly a lot of work going into this, and not only from the pharmaceutical industry, but groups like Farm Foundation, our partners at USDA, veterinary associations, producer organizations, feed industries, pushed to make sure we got information out to address the concerns folks had when these changes actually went into effect in January. So clearly that has resulted in a significant change to how antibiotics are distributed and used in animal agriculture, in ways that have been in place for literally decades. Clearly removal of growth promotion was an important change, but I think even more fundamental is the shift from over-the-counter status to veterinary oversight. And it's really a foundational change to really support and reinforce the idea of implementing stewardship. While certainly veterinarians have played an important role for years in providing assistance to and services to producers, this really did change the dynamic in terms of how products are distributed and sold, and it really changed the role that veterinarians were playing, and certainly put responsibility on their shoulders in terms of how to manage these products. So overall, I think because of a lot of work that a lot of folks did leading up to this change, the shift went relatively smoothly. There of course, continue to be issues. I mean, it's not by no means perfect, and it's certainly a lot of impact across the industry. The challenge certainly was it impacted a very broad range of folks, everything from 4-H'ers or small backyard operations all the way up to multi-state integrated companies and everything in between. So you can imagine there's a variety of circumstances. Clearly the different production sectors, in some production sectors, some commodity areas, whether it's cattle or poultry or swine, I mean, there's variety within each of those sectors, but certainly there's huge variation across those sectors. So there's been some areas more challenging than others, and those are issues we're continuing to work through. Even 10 months in, I think we're still we still have some issues to sort out. So moving forward, I think while there's been a huge amount of progress moving forward in the changes that have gotten done over the past year, unfortunately, it didn't resolve every issue, and there's more work that we need to continue to do. Particularly in the arena that FDA is focused on in terms of the products themselves. One, we are needing to make sure that have we optimized or have we made sure that these products are being used as appropriately as possible. I think we are continuing. I mean, the good news is all these medically important antibiotics in feed and water are under vet oversight, and the therapeutic uses are under vet oversight. Are there additional changes we can make to improve upon how those products are labeled and used? And that's one issue that we're focused on, and particularly products that are in the marketplace that don't have defined durations of use. Is there more that we need to do in terms of better targeting the use of those products? While we did shift all the feed and water medically important antibiotics to vet oversight, those two dosage forms represent about 95% or so of all the medically important antibiotics. But there is a small percentage of other dosage forms like injectable products and some other products like intramammary oral boluses, for which there are still some over-the-counter availability. And I think that's another issue we need to look at. And then thirdly, as companion animals, certainly in the One Health idea, we need to make sure that we're looking across all species, and I think that's certainly one area that we need to look at and make sure that we're doing what we need to do there. These are all issues that, for us, we've not set any specific timeline. I think they're just issues that we're now looking at. Our desire is to follow the similar path that we did before and work collaboratively with affected stakeholders and sort of mapping out a pathway forward to address these issues as well. So in the end, I think we see the goal is curbing resistance through optimizing antimicrobial use practices or good stewardship. Clearly, the changes made effective January 1 are a huge step forward and a major milestone. Supporting stewardship really is something that requires engagement across a whole variety of stakeholders, and we believe that continued progress really needs a collaborative approach. Thank you.
Thank you, Bill. Our final panelist is Dr. Amy Batal. Dr. Batal has been the Sanderson Farms corporate nutritionist for the past 3 years. Her primary responsibilities at Sanderson Farms include overseeing feed programs, feed milling, ingredients, and finished feed quality. She received her Bachelor of Science at Cal Poly San Luis Obispo, her Master's in Poultry Nutrition at Iowa State, and her PhD in Poultry Nutrition from the University of Illinois. Prior to coming to Sanderson Farms, Dr. Batal had experience teaching at the University of Georgia and in technical services at Huvepharma. Dr. Batal.
So this is hard for me to sit, and I have a little bit of different perspective than the other three at the table. So how many of you know of Sanderson Farms? What do you know? Chickens, what else? Nothing else? We said, say that again for me, please. That is correct, and I think that's the important thing. So who we are, I guess, is not so important since I'm limited on time, but we are the third largest poultry producer in the U.S. and currently do about 12 million head a week, and we're growing. And we've been growing significantly since '97, and all that is organic growth, meaning we build our own complexes, we build our own processing plants. We aren't buying other companies. And we are located in where you guys weren't able to go, the Southeast, right? Where nothing was done in the Southeast, but we're located mostly in the Southeast. We have a little bit in North Carolina and a little bit of Georgia. Our primary responsibility is to our customers and consumers. Our primary responsibility is food safety and animal welfare, and that is our biggest objective. So why don't we plan, or why does Sanderson Farms not plan to stop the judicious use of antibiotics? First, something I have a real hard time with is now we say judicious use of antibiotics. It implies that we weren't using them that way prior. Now, we have veterinarians. We've always had veterinarians on staff. They were always the ones, along with, to decide what we use and how we use it. So I think to say this wasn't the case before is part of our problem. We are putting out a perception to the public of something that is not true. At least in our case, it is not true. Animal welfare. We have a responsibility to relieve and prevent animal suffering. For us, it's the humane thing to do. To let those animals suffer is not the humane thing to do. Food safety. And I don't know how many of you know this, but healthy chickens means a safe food. This, and I talked to Randy Stinger a lot, we know for a fact that taking antibiotic use out of poultry production leads to chicken carcasses that have more food-borne pathogens. And I think that's something we're forgetting to talk about. So are we making our food less safe by saying that you cannot use them or saying that we don't want to use them? Sustainability. And here's the thing. We all talk about sustainability, but does anybody know what it means? If it takes us, especially if we go to a slower growing bird. So if we grow our bird slower, we're going to use more feed, more land, more gas, more water, and we're going to have more fecal matter to deal with, right? How is that sustainable? It's not, and we all know it, but yet we keep forgetting to talk about it. So raised without antibiotics is the new hormones added. So hormones. We all use hormones in chicken production, right? Right?
No.
We always have, right? That's the general assumption by our population. Still to today. And we do not use hormones, right? One, it's FDA, it's illegal. But yet our whole population assumes we do. So raised without antibiotics, to me, is doing a disservice to us again. We're just marketing ourselves right into a hole that we're never going to be able to get out of, just like no hormones added. It implicates that anything without this label is unsafe. And I think that's our biggest problem, is we have to educate our consumers that does not make your food supply more safe, that does not make it more sustainable, and that does not help animal suffering. What fears are driven with raised with antibiotics? Fear of antibiotic residues. Is there antibiotic residues in chicken meat?
No.
No. There never has been and there never was. Now people assume there is, just like they assume we add hormones. Something else we're going to have to fight. The fear contributes to human antibiotic resistance. Now, and I don't know, Bill can help me or Joe, do we have a link between between antibiotics used in food animals to human antibiotic resistance?
Yeah, I mean, yes, I think there is data indicating a link. The challenge is quantifying to what extent that use is contributing. So
okay,
I
now
think that's the challenge.
And the challenge is none of the antibiotics we use in poultry production are used in human medicine. And we don't have any resistance to our antibiotics because we're concerned about that. If we, in the poultry industry, have almost zero antibiotics left to use. So now they're all under VFDs, and we've made the consumers believe that we are leading to antibiotic resistance. And then it comes down to raising that. Producers claim that they want sick flocks treated as needed. However, treatment undermines the benefits of raised without antibiotics. Will antibiotics still even be available? So let me just throw this up there, and then I'll get to our update on progress, I guess. And I apologize, I've been really sick yesterday and this morning, so. But most commonly used antibiotics are ionophores. I assume all the cattle people know what ionophores are, right? That's really what we use in the poultry industry, ionophores. They treat cocci, and they're ubiquitous around the world. They're not classified as antibiotics in Europe, but they do have antibiotic. The biggest thing is not used in human medicine. So what's the risk to human health? What is the risk? So why would we take them out just to satisfy consumers that are improperly educated or informed? Antibiotics used to control ubiquitous Clostridium challenges. Bacitracin. Where do we use bacitracin in human medicine?
Skin infection.
Skin, right? Is anybody resistant to bacitracin? Not that I know of. Bill may know better. Not that I'm aware of. Virginiamycin has actually been put on the medically important list. However, there's no human drugs that use virginiamycin, the same one we use. And we can go down the list. The thing here is what I'm pointing out is we have very few antibiotics left. And most of them are not used in human medicine. So what's the risk to human health? So what damage are we doing to our industry? And this is just me talking about chickens and talking about poultry production. We need to take a look at how this is affecting our industry versus just making $1. And this is what's happening just like it did with the hormone issue. You know, we market it all the time. How many people of you buy chicken that says no hormones added? It's crazy. Slow-growing chickens, cage-free chickens, GMO-free chickens. Are chickens GMO?
Yeah.
No. What's GMO? Chickens are selectively bred, just like most animals. So what's different between the two programs? What is in common between the two programs? Conventional versus no antibiotics ever. Both use ionophores. Both will often use antibiotics in their breeding stocks. And when I talk about antibiotics, I'm talking about bacitracin and virginiamycin, because that's all we have. Both are going to control diseases by best management practices. We have always been doing that. There's a reason why the chicken industry is so efficient, why we have a 1 to 6 feed conversion versus the cattle industry that has a 6 or 6.6 feed conversion. Because we utilize best practice managements. We provide clean hatcheries, downtime, optimal poultry, and vaccination programs to minimize disease. We use water acidifiers to minimize antibiotic use. We avoid antibiotic treatment unless it's necessary for the health and well-being of our bird safety and food supply. But here's the biggest thing, and this is what we're seeing everywhere, and my friends will tell you this is true. Who decides what products can and can't be used? In a conventional program, which is Sanderson Farms, and we have no plans to go away from a conventional program, because who decides what we use? The FDA and the veterinarian. But in a no antibiotics ever program, the marketing department decides what to use. Because that sales department has so many products sold that they have to have no antibiotic ever birds to sell. And so they won't treat birds if they're sick. And I've talked to people. I know this for a fact. That's what happens. That's what we're doing. We're pushing ourselves into a corner. What kind of pressure comes into play for the veterinarian when trying to deter? The veterinarian in a conventional program does what's in the best interest of the animal, not what is demanded by the marketing or sales group. Does a no antibiotic ever program actually produce a healthier bird than a conventional bird? I don't even know. I mean, how do you determine healthy? So VFDs, and I think this is really what you wanted me here for, is talk about progress on VFDs. So VFDs were implemented January 1st, Veterinary Feed Directive. We pretty much did this anyway. It's the government's way to enforce judicious use of antibiotics. We were already using antibiotics judiciously because we don't have many, so we can't afford for them to be lost, or we can't afford for resistance. Veterinarians were already scripting any medication used in water to monitor control, and we have always had veterinarians and nutritionists on staff in the field working with the birds. So changes, this is the big thing. Changes to new regulations. Any use that were indicated for gain or improved feed efficiency were eliminated. And Bill spoke about this, right? Any growth promoting claims of antibiotics were eliminated. Okay, that's fine. But I'm not sure this is going towards the goal that they have. And I'll tell you why. And only the use levels indicated for prevention or control of a disease are allowed. Why do I question that a little bit? Does anybody know? What has this done? Nobody has any idea? What has this done for us? It's basically made us use the higher levels of all the antibiotics or all the drugs, which aren't very many. We now have to use the higher level. Where before, when we used BMD, we could use levels from 4 to 50, right? Now, we have to use a minimum of 50. So instead, we're using twice the antibiotic level, or some cases 3 times the antibiotic level, than we used to and get the same results. And I can talk about other antibiotics. Virginiamycin, same thing. We could use a lower dose and get the results we needed to prevent and control disease, then now we have to use the higher level. Regardless of whether the veterinarian or we feel the lower dose is just as efficacious, can have an impact. That's my biggest thing right here. And I understand that these were originally accepted because they improved gain or improved feed efficiency. But you have to remember when that was. That was before we could ever really quantify what they were sick of and how this was improving gain and feed efficiency. Because they were sick, otherwise it wouldn't do anything. And I can run a study with you right now in a clean environment and BMD won't do anything, right? But if it was doing something at these levels, we know these birds were sick. And now we have to use 50 grams per ton We cannot use 10 or 25. We have to use 50. We can go up to 200, but now our minimum is 50. Practically, implications of the VFD in field, really it's more paperwork and it's increased our inclusion levels. That's fine, the paperwork is fine. We were doing that anyway, so that wasn't an issue for us. The biggest issue, I think, is our increased inclusion rates. We did not want to put more in when we don't need to. So does this mean better? Does this make this better? So the only thing I do have to say is our progress has been good. We do have VFDs. We did them anyway. We have no problem with that. The positive outcome we see is now consumers now believe we are taking care of and having veterinary oversight. The problem is this is just a PR thing because we were doing this anyway. But there is a positive outcome is that the general population now believes we are taking care of our animals and we are having veterinary oversight. That's all.
Thank you, Dr. Batal. I know we don't have a lot of time, but I expect there would be some questions in the audience. Yes, ma'am.
I actually believe that streptogramin is used in human medicine. There's a drug called Sanderson, which is quinipristin, dalfopristin, that's used for vanco-resistant enterococcus. So just to let you know that.
Yeah, but they're different. They're different families, aren't they? Within the Streptococcus.
Well, it is a streptogramin drug, and so I think that concern is there.
Yeah, but they're different.
Other questions? In the back?
First of all, thank you all for your presentations. Much appreciated the insight that you've shared. But as we've worked across the industry to implement the VFD, and you all have dealt with it from your end, do we know or have we realized, and I'm going to preface that also with, we all have the same goal in mind of eliminating or reducing antibiotic resistance. But when we go through changes, there are unintended consequences. Do we know what the unintended consequences of the implementation of the VFD so far have been on the animal ag industry in terms of its impact on animal health, animal care, animal welfare? Some of that was alluded to by our last presenter. The other question that I have for a couple of you is, what has the financial impact been? Have we looked at that yet? How much is this costing the animal ag industry? I know of instances where smaller farmers have purchased a ton of feed, and that ton of feed might have cost $300 or $400, and the VFD itself was $75 to $100. So we've effectively increased the cost of that ton of feed to the producer by about 20%. So there are two questions there, but I think they're two important questions that we need to fully look at, understand, and realize in terms of the challenges of implementing some of these changes. Keep in mind, though, we all do have the same goal of fixing the problem.
It's well said. I'm going to just summarize your question really is, what is the outcome of the efforts that we've made, and very specifically the Veterinary Feed Directive? What is the outcome that we know to date in terms of animal disease? And what is the outcome in terms of economics? So that's, I think, a summary of, and if we don't know yet, when might we have that kind of information available to us?
Well, I can comment on part of that. I mean, I think certainly there have been some issues that relate, not surprisingly, relating to access, in terms of clearly shifting products to vet oversight, therefore requiring, changing distribution channels, and depending on, the sector, certain sectors or certain parts of the country, access to veterinary services has hampered access to products. So I think that's, again, affecting certain areas. There's also certain products, for example, the cattle industry, much more diverse, sector than maybe some of the other sectors. There are certain products that we've had some difficulties with in terms of continued access to, necessary medicated mineral products, for example, for managing anaplasmosis. There's been some challenges with that, which we're still working through. Certain different sectors, like for example, honeybees. That's been an issue because clearly prior to this change, honey producers, have used several products to manage certain diseases like foul brood, which have been available OTC, and there's been sort of limited interaction with, for the veterinary profession with in terms of bees, and so that created an access problem because we didn't have sufficient numbers of veterinarians to prescribe products that were needed. I think progress is being made there to sort of fill that gap. As far as impacts, I think we're 10 months in. I suspect that we'll be seeing some further analysis of this in terms of economic impacts, but I don't have anything to point to at this point. But again, we are aware certainly that there are some problematic areas, and when they become visible, and we're trying to work through them with those that are affected.
So I'm going to just restate at least one part of your question and tell me if I'm right. The first part of your question was to ask on outcomes, really in terms of morbidity and mortality, I believe. Tell me is that right?
Sure, yeah, and overall animal health and animal welfare. And then the second part, the negative unintended consequences from an economic standpoint and what it's costing the industry.
Yes, now I'm not aware of any significant animal health issues, or other than it's again because of, in some circumstances, delay in access because of, and in the case of say cattle and anaplasmosis, we recognize that there were not a sufficient number of approved medicated feed formulations to deal with anaplasmosis, and we've been working with the industry to make sure they have continued access to products while those gaps are being filled. So we are paying attention to those circumstances and trying to make sure that there's still access to products, while the issues are resolved.
Dr. Batal, clearly this is an area of concern for you and for Sanderson Farms. Are you aware of any data at this point that suggests that this reduction in use has had an impact on health of poultry?
Not within our company specifically. I do know in other companies, and some of their vets are upset about it, but they have been told, not to use things because, again, then the birds have to go to a different channel.
Anybody else on the panel want to deal with that question?
I think we're fortunate in the companies that we work with and the producers that we work with that we're already trying to make those improvements. Like I said, those improvements in genetics, the improvements in our management practices are probably our biggest challenge, are some of our high-risk cattle that come from unknown origin, but we're fortunate to have wonderful vets that we work with that are on top of it, and we adapt them.
Thank you. Anything else?
No, I'm a recovering lobbyist, so I don't have anything.
Next question.
No, maybe not a question, just a small comment and technical correction. So, had a bit of debate over the streptogramin class, and I think Dr. Flynn can expand if he needs to, but Synacid is not approved for vancomycin-resistant enterococcus. It was, but the FDA removed that approval in 2010 due to lack of demonstrated efficacy. So I'm sure there are no medical practitioners who are using Synacid for VRE because it wouldn't be effective. It is actually approved, though, still in the USA for methicillin-sensitive Staph aureus. I'm not sure if any medical practitioners would be using Synacid when it's methicillin-sensitive, but it technically could be available. If there are any medical practitioners in the room who've used Synacid in the last 5 years, I would be interested to talk to you, because I'll declare my vested interest. I work for the company that makes Virginiamycin, the animal drug, and we've worked quite hard to try and find where Synacid is used. Apparently it is, but we can't find it. So if there are any medical practitioners here, Richard Coulter, come and tell me. If you've got friends who are the specialist infectious diseases doctors who've used it in the last 5 years, again, we'd love to know who you are. Thank you.
Thank you, Richard.
And Dr. Saltman, we're up against heartbreak.
We are. Thank you very much.